Hi there, and welcome to another episode of Innovista Values. Thank you for joining today. My name is Vic Bakhru. I'm your host and CEO of Innovista Health. I'm joined today by Brenda Young from our team. She is our senior healthcare coding specialist based in the Dallas area. So let's kick things off. Brenda, tell us a little bit about yourself.
Well, hello. I am, as you said, a healthcare coding specialist. I've been in the field for 20 plus years and have reinvented myself multiple times throughout the changes in the health information management arena. And working with risk adjustment is just my latest reinvention, the new me.
Yeah, no, that's great. Thanks for sharing that. And, just before the video started, we were joking about how we're going to talk about how long we've both been in healthcare. And we decided 20 plus years is the way to say it so we both don't sound so old. So I think you pulled that off just great. And I'll ask you now as a follow-up question, how long have you been with Innovista Health?
I've been with Innovista 5 years.
Okay, all right. And tell me a little bit more about the team you work with and the work you do here.
Well, we have a very small team. Tell you a little bit about how small it is. We had a meeting in the office a couple of weeks ago, and they were taking group pictures, and so there are only 3 of us. And someone said, "Where's the rest of the team? Where are the rest of you?" It's like, this is it. We 3 handle all of the work for the risk adjustment coding side at Innovista in the North Texas market. We have our manager and then 1 additional coder. Since the start of the pandemic, we have done most of our work meeting with the providers face to face, but we do have some in-person meeting now, which is very, very nice to get out once again and have that face-to-face contact with the providers. And I think they like that as well.
Yeah, tell me a little bit more about the providers that you support, and sort of what the day-to-day looks like.
Well, of course, with the risk adjustment, we're dealing with primary care providers, and on a day-to-day basis for myself and even with the team, we do a lot of chart auditing. We're reviewing the charts to identify the chronic disease processes that do affect the risk adjustment. And then we put together reports, education documents that are tailored to the specific audit for that provider. And then we either, face to face or virtually meet with them, review the audits, and also go over the educational material that targets the areas that we would like to see them strengthen their coding skills and their documentation.
Sure. Now, for some of our viewers who might not be too familiar with the importance of coding accuracy and the connection it can actually have to having the right resources in place to serve people who may have needs in the social determinants categories or really across the healthcare spectrum, help us understand a little bit more in the weeds of what does a chart audit look like? What are you doing minute to minute as you're looking through a chart? What are you looking for, actually?
Well, for risk adjustment, the basis, of course, is to identify those chronic conditions that the patient has that have to be monitored and followed, throughout the year, which from that perspective, with our whole population health team, it sets the benchmark for, the payment per member per month. So when I go into the chart to audit, I'm looking for those chronic conditions that, such as diabetes, chronic kidney disease, dementia, those things that the patient actually needs some hands-on, care. They have to see specialists. So I'm looking for those diagnoses, making sure that they're documented and submitted on a claim at least once a year to the Medicare payers, because that sets the payment per member per month. And then that ties into, our expenses and how that provider and our organization gets paid for the services that we provide to the patients and the providers.
Okay. And, if I've understood correctly, over the years, sometimes these diagnoses fall off the chart, if you will, right? The person who may have had diabetes last year, it resets sometimes when you cross over the new year. And so in some cases, the diagnosis falls off the chart, if you will. So is that part of your workflow? Do you ever see that happen sometimes where you see a particular patient who had a diagnosis previously that probably still applies, but for whatever reason, it's not part of the equation anymore?
Yes, I mean, when our audits, especially on a new patient chart, we do what we call a 3-year look back. So we're
Okay.
looking back within that 3-year period to see if there were any diagnoses that got dropped. And an interesting story that we tell within our group, if in talking about a patient with diabetes, there may be an amputation. And so, as you mentioned, at the beginning of the year, the risk score resets, and
Mhm.
we have to submit that diagnosis again to get that risk score back to the correct level to identify all the chronic problems. So if they don't diagnose that or submit that diagnosis for the amputation, then it looks like that limb grew back because it's no
Right.
longer out there to say that, a great toe was amputated last year, 2 or 3 years ago. So those are the types of things as well that we're looking for, not just any new chronic diagnoses, but to refresh that provider's memory that these are the conditions that the patient has that you need to repeat. And also, let's say with a patient who has exudative macular degeneration, primary care doctor doesn't treat that diagnosis,
Sure.
but as the gatekeeper for that patient's overall health care, it's important that they identify to CMS that they are aware of that problem. I'm following up with ophthalmology and specialists to make sure that the patient is keeping their appointments and that those appointments are scheduled. So to remind them, yes, that diagnosis needs to be coded on your side at least once a year. And a lot of that information, of course, comes through on a consultation report, gets filed in the chart. So not only are we looking at that provider's notes, but we're looking at consultation reports, ancillary service documents to look for any diagnoses that need to be captured for the risk adjustment process.
Okay. So educational. I feel like I learn something new every time I talk to you. And so I thoroughly appreciate you walking our viewers through that as well. So, there's so much opportunity to bend over backwards to meet the needs of the people that we serve. And sometimes it's the providers, sometimes it's the members we serve. And sometimes you try to have a little fun while doing it, right? And so tell me a little bit about that process of having fun at work while doing the important stuff that probably isn't in a job description.
Well, we like to just kind of get together sometimes and hang out. We'll go to lunch. We meet up sometimes on the weekends. And of course, conversations always kind of gravitate back to work,
Uh-oh.
sharing ideas about how we do, because even though we have a playbook and it identifies how we go about our work, we do try to customize our interaction with the providers to that specific provider's needs. If you will, I'll give you an example. I went into a provider's office in September who was a little bit disturbed with the format that the information was presented in. And so I kept saying, well, okay, tell me what you need and I'll make it happen. So I go back the next month and still wasn't really satisfied. So, okay, tell me exactly what it is that you need. I don't like your form. Okay, she told me what she needed. And so what I have to do for that particular provider is to actually audit using our current format. And then I go back once I'm done and I take out the information that she doesn't want to see, change the headers to meet her requirements. And then I keep the copy that I have made for myself so that when I'm discussing, I'm bringing out the points that I need to. But we met actually last week. I gave her the new form and she was like, perfect, I like this. And she even took me to lunch. So that tells me that, I did a good
Doing
job.
something right.
And that's how our team works. We share ideas. This is what I do for this doctor. And we kind of piece those things together to make sure that while we have a standard, that we're making sure to meet that provider's needs. So that I think the most important reason for that is so that they hear what we have to say and they apply what we are sharing with them to the risk adjustment process.
Sure. No, that all makes sense. And major kudos to you for having such a customer service oriented mindset and for delivering and going the extra mile for our providers who, candidly are on the front lines and live very busy lives. And sometimes, processing information in a certain format is really important to their success. And the fact that we have individuals on our team who take that mindset of, jumping through a lot of extra hoops, let's be honest, but we get the job done at the end of the day. And then they want to spend more time with us, which I think is one of the strongest testimonials you can, sort of have about the relationship, that we build with providers. So thank you for all that you do and for sharing that with our viewers.
Right. And I'll say this, and the providers we have this conversation, they were trained to take care of patients, not to actually live in the business side of medicine, which has exploded exponentially. I mean, you go into a doctor's office now, and you've got two people to one just taking care of the paperwork side, and physicians were not educated to be coders. And so I have to, as our team, show that we have an understanding of the medical side, but we're here to bridge that gap between your medical knowledge and translating that knowledge into, the numerical codes that go out to the payers that help to get all the funding.
Yeah, no, absolutely. Well, Brenda, this has been an amazing conversation. I am so thankful that you had a chance to participate and let our viewers know about all of the important work that the folks on the front lines like yourself are doing day in and day out, and have for I was about to say many years, but we won't go there, will we?
It's okay.
Well, anyway, thank you all for joining. It's been another great episode of Innovista Values. I'm Vic Bakhru, CEO of Innovista Health, and today I was joined by Brenda Young, our Senior Healthcare Coding Specialist. Until next time, take care.